These all swelled up, very red, got very hot.
Okay, but for how long? Like that? How long you have had that?
I think it's been about 3 or 4 months.
3 or 4 months? And how did it start? It just out of a well? Did it start like that? Or?
I think it started with a cut here.
Okay.
They gave me a tetanus injection.
Okay.
And then antibiotics.
Okay.
And we think that might have killed the gut, the flora in the gut.
Okay. Describe more about your leaking guts. Okay. What is the, you call the leaking gut symptom? I'd like you know, say more about the symptom.
I think it was diagnosed with gluten intolerant, candida, which is a yeast, and I took off all gluten, all sugar, all yeast.
Okay.
And we just tried everything with Brenda, acupuncture, nutrition, lots of water, parsley drinks, all that sort of thing.
Okay. Do you vomit?
No.
Do you feel nauseous?
No.
Do you have a loose stool?
No.
Do you have constipation?
No.
Okay. And then how do you know you have a candida symptom then?
I went to natural therapies where they specialise in that, and they diagnosed that as initially as the gluten intolerant candida, and I started there. This was much bigger, it was much more swelling. It has gone down with Brenda's help, and just change of diet and lots of fluids and nutrition to try and get rid of the what I call toxins.
And you have a pain in your abdomen?
No, it's only around the legs.
Everything is happening today.
And a little bit up the top.
Do you mind showing
No.
everybody your,
No, not at all.
your front and your back?
It came over the whole body.
He's got a good button.
Oh, okay.
So
It's a lot better than it was.
this used to be very, very red with quite like points on the thing on the back, which I couldn't see much of. But they have gone down working with Brenda.
And extremely itchy.
Itchy.
And purple.
You what?
Around the ankle it was purple.
Okay.
And, what else? Weeping.
Yes.
His legs were weeping, but they're not anymore.
No.
Itching?
Yes.
Now this,
These are called lipomas. Fatty tissue that my granddad had them, my father had them, I have them, and my son has them. Hereditary.
Okay. And have a itchiness? Okay.
Yeah, a little bit itchy here, but more itchy on the legs.
In the body. And you said 3 or 4 months?
About that.
And after you change your diet, they improve?
It improves a little bit. These good, much better.
Okay. Which direction of the diet you change to? Like in comparison, before what you eat and after you change?
No dairy. I've cut out dairy, cut out bread. Anything, I look at the label, anything that says yeast or sugar or gluten is out, and that's taken a couple of months to do that. It seems to be helping. And I think with Brenda's help, parsley drink, been very good.
Okay.
And that's where we're at.
You drink coffee?
No, cut that out.
You have to cut it off too. You used to drink coffee.
Little bit, not much.
Not much. How about chocolate?
No, not a lot.
Okay. Do you increase the green vegetables in your diet?
Green vegetables, spinach, kale, lettuces.
How's your blood pressure?
And a lot of vegetables.
Okay, how about blood pressure?
Good.
Yeah, in the past, blood
Always
pressure.
good.
Oh, okay.
Yeah.
Oh, good. All right, sit down, and you can put your shirt back on.
Brenda, have you done any bleeding on him as part of your treatments?
No, at first it was extremely hot to touch, and at first I, did to get rid of heat and also the damp because his legs were weeping. Now, a lot of it started when he scratched his ankle, and they used topical antibiotics, and it seemed to get worse as well. But a lot of it is stress related. Stress related.
Stress related.
Yeah.
A lot of it.
Yeah. When you went down to, you had a really bad car accident
Yeah, that was a few years ago. But
in the South Island.
what triggered it off to me was I had to go down to the South Island last year, and to get away, I worked long hours. I'm 69 years old. I shouldn't have done it, but I did, and I think my body started at that point, said enough's enough, and bang.
And I've been treating Roy for Tai Yin Yang Ming, stress-related issues, balanced digestion and skin.
Okay. What kind of
So
strategy
you did Tai Yin Yang Ming?
Do you use
It's about-
meridian conversion?
Yep.
Okay. All right.
So Tai Yin Yang Ming. And did you do anything else? Yes, this?
No.
No. Okay, just this.
At the beginning, I went through the basics, heat and damp, and because these are weeping so much. So, I went back to the old way.
Okay. Okay. Let's see what I have to think about what the strategy best. Okay, I'm going to use Tai Yin Yang Ming seasonal clock. Okay? Yeah. All right? Yeah. Get out. You okay?
Yeah.
Yeah, me too. All right. Tai Yin Yang Ming seasonal clock. Let's see. This way we do this. So,
So you're going to use a metal gua, Dr. Ted?
One moment, caller.
Doing that calculation in your brains.
okay. Okay, stomach 41. Okay. Forty-five. 43. And for Tai Yin, spin 2. That hurt a little.
A little.
Okay, can you take that?
I can take that.
Okay, and spin 4.
43.
Can you call out the numbers, please, because we can't see.
Spleen 2
And spleen 9.
Sorry, smaller. Spleen 4
Right,
Yeah,
spin
2, 4,
and 9.
9,
And stomach 41, 43,
41, 43,
and
45.
41, 45.
41, 43, 45.
And then we do the Yang Ming here. Large intestine 3. I mean 2. You okay?
I'm good.
And 3.
Spleen 2.
Spleen 2.
2 and 4.
And 9.
And
yeah.
9.
And 4.
Large intestine 2,
3,
3,
4.
And then we do lung.
Sorry, we're running out
large
of
intestine 2,
needles.
3, 4.
11. Count 5. And 7. Yeah, kind of watch her. She's asleep. It's good. Don't wake her up. Don't wake her up. I just watch her. In time.
That's the one you do?
Yeah.
That's the one you do?
Yeah. No. Down is
Yeah.
yeah. Down is bottom. Is heaven.
Oh.
Does anybody else have smaller needles than these?
Someone around the tree. Second tree down.
Oh,
This one.
You alright?
Yeah, good.
Good.
they're smaller.
Yeah.
Smaller.
It's okay. Just to give you a warning, it's shorter.
Sorry.
Okay. Year sermon. Why I do the in-time year sermon, because they told me that her symptom is stress related. You know. One more. Okay. Holy, that's why I choose what? Aqua. Okay, because it's a whole meridian. No? If it's an only spot or only patches somewhere, I might not even use aqua. I might use image. Okay. But whole leg, so I choose aqua. Please feed him the mung bean juice. Mung bean juice.
Yeah, I mentioned that.
Did he drink mung bean?
Have you?
I haven't found any.
Okay.
So-
Yeah.
He's very cold as well. Cold hands and feet.
Ah.
Cold hands and feet.
Okay. Okay. And the other thing, because of circulation, that's why. Okay. And the treatment here is where we're promoting the what? Circulation. Sometimes you can alternate. You don't have to stick with Tai Yin Yang Ming. And sometimes you can just do the image here. You can do that too. On all the Yang channel or all the Yin channel. Or all the Yang here or the Yin there. Okay. And today I do Tai Yin Yang Ming because I take it more for general. Why general? He also have those skin problem here. That's why. Sometimes you can focus on the treatment for the circulation down there. Then you can say all the yang or the yin. Okay, yang yin. You can do that too.
And how often would you treat Roy?
And 3 times a week. Okay, 3 times a week. Treat him at least 3 times a week. If you can manage every day, even better. Okay? Yeah. All right.
And what would your prognosis be? Is it good? How long do you think Roy would take to?
Hard to say. It could be 30, 40, 50 treatment totally. Okay? You need to prepare for that. Okay? But as long as from diet, from treatment, everything start improving, we will get there. Okay? I did help one case I did help some people in much severe situation like you. They even want to amputate their lower leg. Totally, I gave her 78 treatment, and the leg totally recovered normal. Yeah, that happened. Okay, so you need to be patient. Don't expect that 10, 20 treatment you'll be done. Okay, it could be 30, 40, 50 treatment. okay, I would say. But how many exactly depends on how well you respond down the road. Okay? Yeah. But again, you can do local balance too. Just focus on the leg.
Yeah.
3 young, you do a bunch of needles. Okay? Or 3 in, or you can do 3 young here, 3 in there. That's another possibilities. Okay?
What do you think of the leaky gut diagnosis?